Hi, this is our PharmII Nursing 389 group project. We're doing digoxin. I'm Joyce Alcalde. I'm going to be taking the video.
I am Lucero Diles, and I'm going to be the patient.
My name is Hardeep, and I'm going to be the nurse.
And our scenario is a 50-year-old female named Mrs. Smith who was admitted to Adelphi University Hospital for heart failure. The patient has been treated since November 10, 2015, and she's getting ready to be discharged today, November 19th. Nurse Hardeep will be speaking to the client about the medication she is about to administer, which will include the purpose and effect of the medicine. Then she will discuss the medication's proper administration, interactions, and adverse effects, which are all part of the discharge instructions as well. The patient is currently A&O times 3 and is in no apparent distress. Her heart rate is 85, respiratory rate is 18, blood pressure is 125/82, and she is willing to discuss her discharge instructions.
How are you?
Good, thank you. How you doing?
Good. My name is Hardeep. I'll be your nurse for the day. Your nurse Joy, she left for the day, so I'm covering her shift.
Okay.
Can you tell me your name and date of birth?
Lucy Smith, December 7th, 1965.
Okay. Okay, Miss Smith. I see that in your EMR you're due for a last dose of digoxin before you head home.
Okay.
So I'm going to give that to you.
Okay, what is this medication I'm getting?
This medication helps treat your heart failure. It's sometimes called enoxin. It helps your heart's ability to pump blood and also improves your symptoms like shortness of breath that you were having earlier. You're also going to be going home on this medication, okay?
Okay.
So before I give you this medication, I need to check your apical pulse and your blood pressure.
Okay, that's fine with me. However, why are you taking my pulse and my blood pressure?
Well, with this medication, sometimes it can decrease your blood pressure and your heart rate, so it's important for us to monitor it before we give the medication. Usually should be between 60 to 100 your heart rate, and your blood pressure should be between 120 to 80. So if it's more or less than that, we will call your doctor and let him know and follow his instructions, okay? So I'm going to take your blood pressure.
Okay.
Okay, your blood pressure is 125/82. I'm going to check your apical pulse.
Okay.
Your apical pulse is 82, okay?
Okay.
So now before I give you this medication, I need to ask, are there any cultural beliefs or any rituals, or are you fasting that's going to prevent you from taking this medication?
No, I'm not fasting. I don't have any cultural beliefs, but thanks for asking them.
Okay, great. So I'm just going to prepare your medication, okay?
Okay.
Alright, digoxin 0.125 milligram, 1 tablet. Okay. Can I get your name and date of birth?
Lucy Smith, December 7th, 1965.
Okay. Scan the medication.
Thank you.
I'm just going to get all your discharge paperwork ready, okay?
Thank you.
Okay, Ms. Smith, I have all your discharge paperwork with me.
Okay.
It explains everything about the medication, but we're going to go over this together. If you have any questions, you feel free and ask me. Okay, here's your copy.
Thank you.
So when you were originally in the hospital, you were on a higher dose of digoxin, but since we're sending you home, we're going to be sending you home on a maintenance dose of 0.125 milligrams per day, okay?
Okay, I understand. So now, how often should I take my digoxin?
With this drug, it's very important to take as directed. Your doctor has directed that you take this medication 1 tablet a day. I already gave your dose right now, so the
Okay.
next dose will be tomorrow morning.
Okay.
You should try to take this drug at the same time every single day. If you miss a dose, if it's less than 12 hours, you can take it, but if it's more than 12 hours, you skip that dose and you don't want to double up on the dose because that can be very toxic and increase your risk of toxicity, okay? And we don't
Okay.
want that. And you also don't want to stop taking this medication because it can make your heart problems worse. And you want to avoid taking any antacids or any antidiarrheal medications within the 2 hours of taking this medication, okay?
Okay. And does this medication have any adverse effects that you'll be aware of?
Yeah, some adverse side effects that can occur is you might feel extremely tired, weak, you might develop a headache, blurry vision, abnormal heart rate, loss of appetite, nausea, vomiting, diarrhea, and bruising. So it's very important for you to understand these signs and symptoms, and you should also monitor for toxicity.
Okay. And what are some signs that I should monitor for toxicity?
Well,
What
for-
if it happens? What should I do?
Okay, so for toxicity, a lot of these signs can resemble those of the flu or the cold. So it's important for you to monitor any changes in your, any changes or any pain in your stomach or any nausea, especially any vision changes, any green or yellow hollows, any abnormal heart rate, if you feel like your heart is pounding, you let us know. So these are very considered very harmful effects of the medication, and it's also called digoxin toxicity. You want to
Okay.
call the doctor right away and inform them and seek immediate attention if any of these occur, okay?
Okay, I perfectly understand. What about, can I take this medication with any food?
Well, it's advised that you don't take this medication with any food. You take it in the morning, first thing after you get up. Because if you take it with foods that are high in fiber, it can not work as effective.
Okay.
And if you have to take food, then you can take it 2 hours before and after a meal, okay?
Okay, so I understand. So basically, tomorrow when I'll be taking my digoxin, I will take my digoxin 2 hours before my cereal, correct?
Right, good.
Okay. What about, does this medication interfere with any other medications?
Yes, it could react to certain medications like laxatives. They may also increase your risk of toxicity. So are you on any medications other than this at home?
I'm currently not taking any other medications other than digoxin. Digoxin is the only medication that I'm taking. What about any natural products? Will that interfere with digoxin?
Yes it does. You can't take this medication with lip gross or aloe. If you take the herbal, St. John's wort, it can interfere and decrease the effects of digoxin, so you want to
Okay.
avoid taking that.
I
Are you
see.
taking any of these herbal supplements at home?
No, I'm not.
Okay.
And what should I do if I experience any of the side effects?
Well, if you experience any of this, you want to contact your healthcare provider, seek medical attention, and follow the instructions they provide you with, okay? And you also
Okay.
want to schedule routine follow-ups to determine the effectiveness and to monitor for any toxicity.
Okay.
Okay, so remember at the starting when I was giving you medication, I checked your apical pulse right underneath your heart. So when you're going to be home, it's going to be a little hard for you to check. So I'm going to teach you how to check your radial pulse before
Okay.
taking the medication.
Okay, perfect.
Okay, so I'm going to ask you to take out your wrist. You're going to put your index finger and your middle finger and your thumb side. Do you feel a pulse?
Yes, I do.
Okay, you're going to count that pulse for 1 full minute, okay?
Okay.
You should get about 60 to 100 beats per minute, which is the normal range. If you get anything more or less, you contact your healthcare provider and you see what they tell you, and if you have to withhold the medication, you withhold the medication, okay?
Okay, I understand. So count for 1 minute, and it should be between 60 and 100, correct?
Right.
Okay.
And also you contact your provider if it's more or less than 60 to 100 beats, okay?
Okay.
Do you have any other questions for me?
No, I think I understand everything in regards to medication. Thank you.
Can you explain back to me what you learned?
Of course. Okay, so basically you told me take one tablet every day at the same time, preferably after I wake up on an empty stomach. I should avoid foods high in fiber, like my cereal, essentials, words, and laxatives, because any of this will interfere with the medication I'm taking. I also need to check my radial pulse for 1 full minute, and if it's below 60 or if it's more than 100, contact my healthcare provider right away. Also, if I experience any of the side effects such as nausea, confusion, or diarrhea, call my healthcare provider right away, because it can mean that any type of toxicity. And I also need to follow up through my routine checkups.
Great, Mrs. Smith. Thank you. It was a pleasure taking care of you today. I'm going to get your transport team, and then you'll be ready to leave, okay?
Thank you so much, Nurse Radeep. You're the best nurse ever.
Well, thank you. Have a good day.
Thank you, you too.